All right, let's go ahead and dive in. Hi, everyone. Thank you so much for being here today. My name is Mira. I oversee demand gen here at Phil, and I'm very excited to share this great presentation we have today and our speakers, Catherine, Sham, and Neil, who will be sharing their expertise and insights on strategies to streamline the access journey for your patients and providers. We would love for this to be an interactive conversation today, so please feel free at any point to put your questions in the Q&A box located at the bottom of your screen, and we'll also save time at the end for questions as well. Catherine, I'll pass it over to you to get started.
Great, thanks, Mira. My slides aren't moving forward. All right, there we go. So today, as Mira said, we're really excited about the conversation. We are going to be talking through first, really unpacking some of the challenges and impacts that we are seeing, starting really with the state of the industry and how the patient and HCP experience is going from an access perspective. Then we're going to talk about strategies to streamline your access journey and really how to optimize those experiences for patients and HCPs. Finally, we'll run through a case study looking at how a dermatology brand was able to drive a 3x adherence to therapy while really focusing on improving those experiences for patients and HCPs. Finally, Mira is going to have a few resources for you in order to further dive into this topic. Let's go ahead and get started. I am Catherine Wood-Hill. I'm the SVP of Marketing here at Phil. I have over 15 years of experience building marketing programs for both B2C and B2B companies. So really focusing on excellent experiences and ways to communicate to both kind of the end users and individuals, as well as companies as a whole. And I'm really excited to be able to bring those things together here at Phil in order to create really great experiences and messages for our patients, our HCPs, and brands and partners.
Hi, and I'm Neil Dean. I'm a director of product management here at Phil. My main focus is on the HCP experience, the manufacturer experience, and the patient experience. So kind of all the external folks that we interact with is something that I think a lot about. And HCP engagement is kind of a big focus of mine. So excited to be able to speak with you all about that today. Prior to Phil, I was involved with both sales enablement software. So how do we get both inside sales and field teams aligned towards a common objective on message? So pretty relevant to what a lot of you likely do. And then additionally, before that, I was in a clinical cloud software company. So come from a health background as well. Sham?
Hey everyone, Sham here. I'm the director of client optimization here at Phil. I sit within the BizOps organization. And with that, I bring a lot of BizOps experience. My role prior to here at Phil, I was at a tech company. Before that, 6 years of experience in pharmaceutical consulting. So doing brand and business strategy, operations, all that fun stuff. But I think, the thing that gets me most excited is, finding ways to get patients therapies on, for the lowest price. And I think that's something that my team here at Phil we focus on as a part of our client optimization strategy. So, really blending in strategy, operations, and analytics to help get the best outcomes for patients.
Right.
So, as I mentioned, I'm really excited about getting patients access to therapies, but a lot of it, comes down to understanding what are our patient concerns when it comes to getting therapies. And generally speaking, we think about three things when we think about our patient access and patient challenges, which are affordability, convenience, and transparency. These are three things we really try and focus on here at Phil. But in general, affordability is always top of mind for patients. I'm sure you guys are aware of this, but not only as marketers or access folk, but also as people who take therapies yourself, you are also aware of affordability concerns. I mean, 1 in 4 patients don't take prescribed medications because of cost concerns, and 59% of patients, they don't know much about these patient support programs that all of you are working so hard to get out there. So these, affordability concerns aren't just limited to the pure out-of-pocket cost, but also awareness of what's available to them. And the other thing is we live in this very online era where we're very used to fast service and convenience. Getting things shipped to our house is like the new way of doing things. And yet, the pharma space, the medication space, you still have to leave your house, put on clothes, and go get therapies at a local pharmacy. That's something that, patients nowadays are starting to move towards wanting convenience, even in that aspect, right? 1 in 3 patients say convenience is more important than credentials for non-emergent care, right? Obviously, for emergent care, it's a little bit different. And these are 3 things that we're really focused on here at Phil. You're focused on, you're spending a lot of money to getting these patients onto therapy, but like making sure that, patients are getting therapies in an affordable manner, in a convenient manner. And the last thing is transparency. So what is happening from the moment they get that script and send it to get filled to actually getting that therapy? A lot of patients are sort of concerned about, well, thought it was going to be cheap. I thought this was going to happen. I don't know what's going on. I submitted my script and 2 weeks later, I come back and I get a bill for like, $500. Why is that? So that's something that we really focus on here at Phil, to make sure that patients are aware of what's going on at each step in the journey as well. But, to talk a little bit more about what HCPs are facing, I think Neil has a little bit more to share.
Cool. Thanks, Sham. So as I mentioned in the intro, I'm kind of thinking both about the patient experience and the healthcare provider experience. They are kind of 2 sides of the same coin, and you can't really tear them apart as far as outcomes, anxieties, desires, and what they require. So when we think about your teams, so support programs, marketing programs, field sales teams, and how or what HCPs need from them, they require a lot of guidance. They're looking to you all for transparency in the program. So guidance around cost, which channel to use, the therapy, knowing more about it itself. They want transparency into the patient experience, that digital experience that most patients are looking for. Our HCPs want to know what that is, because they're kind of going out on a limb. And once they prescribe that medication, it's a bit of a black box for them. So it's really important to be able to educate them about it. And then lastly, they want help managing administrative barriers and to have less of an overhead there. So kind of similarly to what Sham outlined, when we talk about costs and kind of not really knowing what cost is going to be, in the absence of knowledge, HCPs are, about half of them are not going to be discussing the RX cost with the patient because they're unclear on it. So there's a huge opportunity for education there, to create a better patient experience, a more authoritative HCP experience, and to influence them around what therapies they're prescribing. When we talk about the high burden associated with administrative, we're mostly talking about PAs. And we find that 88% of HCPs experience extremely high burdens associated with PAs. It's kind of that double-edged sword where the more good you want to do, the more work you have to take on yourself. And that is something that kind of wears down an HCP and could affect whether they prescribe a specialty drug or just go for a generic, whether they feel like they can actually handle the volume in doing that versus being able to feel like they're well supported in navigating that, similar to the patient, by the way. And then lastly, they probably, not unsurprisingly, feel that as a culmination of these things, they're not sure that field reps typically understand their needs and expectations. It's very different to be coming in from outside the office, trying to talk with an HCP, and then an HCP with this burden of patient healing, this burden of patient outcomes, cost, ease of access, adherence, all those things. And so from the HCP's perspective, unless that field rep can really meet them where they are, it creates a big challenge to them.
Great. Thanks, Neil. So with all of these things that we've just discussed, we have clients often coming to us with a number of challenges, just given kind of their traditional access strategies and their typical channel strategies. And so what we hear oftentimes, which may be kind of symptoms of poor patient and HCP experience, but are challenges that they're looking to solve, are kind of low awareness and engagement with the various programs that they have. So they may have, savings cards or those sorts of things that are available, but patients don't know about them, HCPs don't know them, which creates the perception of product inaffordability, or that the product itself is difficult to get, which can lead to barriers with kind of adoption. Additionally, we hear a lot of challenges around poor adherence, and there are a number of kind of different reasons that we hear from this, but ultimately patients aren't starting on and staying on therapy because it is difficult to go to the pharmacy. It is difficult to pay the high out-of-pocket costs, or it is, difficult to manage that refill process. And so with that, there are a number of different brands who come to us looking for strategies to improve adherence to therapy. All of these are kind of indicators of high access barriers, but those high access barriers can be prior authorizations with multiple step throughs, or multiple different hurdles that need to be kind of jumped through before you can actually access the medication, and low covered dispense rates. So because there are prior authorizations that the HCPs, don't really know how to deal with, because the hurdles are high, brands wind up dispensing the majority of their prescriptions with a coupon, and wind up, dispensing at an uncovered rate, which is a one bad experience for the patient because the out-of-pocket cost tends to be high. It's a bad experience for the HCP because the patients are complaining about the costs of the medications, as well as really erodes the brand's gross to net and ability to continue serving patients. So these are just a number of the challenges that we hear our clients coming to us as a result of patient and HCP experience. Next, I want to hear, what are the biggest access challenges that your brands are currently facing? Mira is going to put a poll up. If you guys can take just a minute and go ahead and answer, we can use this to help inform our conversation. Okay, I'll give you just another second or two. Looks like some people are still putting their results in. Okay, so it looks like 38% of you are facing limited HCP engagement and education, which is a really common challenge that we hear from our brands, and is something we can speak to over the next several slides. Additionally, that low patient awareness and education of your programs is another one that is really common. And then finally, inefficient pharmacy processes. So we can dig into all of these, but these are the most common problems that we're hearing all the time from our clients, so there are no surprises here. All right. All right, just one. So why some of these traditional approaches can be ineffective. So traditional, channels are typically, for these retail brands, we hear that they are using just a straight retail pharmacy, which I like to call sending scripts out into the wild. From a convenience perspective, there's one on every corner, and it's a process that patients are familiar with, but they tend to have higher abandonment rates. The likelihood that a prior authorization is going to be completed and is going to be completed well is much lower. And additionally, stockouts and those sorts of things can be challenges, which lead to patient frustration when they're unsure when their medication is actually going to be available to them. The next kind of channel that we hear our brands using is specialty pharmacies. Specialty pharmacies can provide for a good HCP experience on the surface. They will, buy your HCP's lunch and let your HCPs know that they'll never hear back from them. They'll never get a prior authorization. And so from an HCP perspective, that really helps to simplify the process and make them feel good about sending their prescriptions to that specialty pharmacy. One of the challenges is that they tend to overuse your coupons and your various access programs, which while you will see patients starting on therapy, it can lead to a high cost and kind of lower number of prescriptions that are actually being covered by insurance for you, and can lead to diminished brand outcomes. Additionally, there's a lot of kind of lack of transparency and visibility into whether patients are actually starting on therapy and kind of what those out-of-pocket costs wind up being, which can lead to patient frustration and ultimately HCP frustration with the brand, because patients may not be starting on therapy as quickly or as often as they would hope. And then we do talk to a lot of brands who are using traditional hubs, and traditional hubs are great and are something that there's a really important place for in the market, but they can be very really high cost and resource intensive, which particularly for drugs that are in kind of this specialty light and retail price point can be cost prohibitive, as well as from a patient experience perspective, they can have less than ideal experiences with phone calls and those sorts of things, which are typically not the way that consumers want to engage with their healthcare. Finally, the last piece is that all of these are an important part of some brands' access strategies, but there are other strategies that can be put in place in order to help to provide the best possible experiences for your patients and HCPs, and we can talk in more detail about that going forward. All right, so we talked about some of the challenges that you are facing with the traditional access journey. Now, we want to understand kind of what are some of the ways that we can bridge the gap between patients, providers, pharmacies, and your brand needs in order to come up with kind of the most effective journey. So, as we talked about, we're looking to optimize the experiences for each of these different stakeholders. So for patients, particularly in kind of this post-COVID era, have really started to expect a consumer-like journey when it comes to their healthcare engagement. And when it comes to, getting their prescriptions filled, that means engaging with their pharmacy the same way they would with any other kind of e-commerce like brand. So they are expecting a simple mobile process, a digital enrollment with an auto refill option that takes kind of the thinking out of their prescription process. They want to know, am I paying the right price and how long is it going to take, and have transparency into their full prescription journey. The same way they would, ordering from DoorDash or something like that. They want to understand that journey. And so by providing your patients with that access journey, you are, really helping to, improve that that patient experience, but also really helping to improve that HCP experience. Patients who understand their access journey and their costs and have that transparency are not going to be reaching out to their HCPs to complain and ask questions and really lead to a perception that your brand is difficult to deal with. For HCPs, they're not looking for a simple mobile experience, but they are looking for an experience that is going to keep them within their existing workflows. And so what that means is if they're used to using their fax machine, they're used to using their EMR, and they're used to using Cover My Meds, then we want to make sure that we are creating an experience that doesn't require them to learn more new tools and to kind of complicate an already complicated process. And so with that, things like a software-driven PA process, things like pre-populating their PAs, letting them know via their preferred communication channel, even if that happens to be fax, that things are ready for them to just go review a prior authorization and click submit, makes it so that their perception of your brand and your ease of use and ease of kind of ability to prescribe is going to be much higher. Additionally, for patients and HCPs, that transparency that we already talked about is critical. We talked about what that looks like from a patient perspective, but from an HCP perspective, that transparency is, did my patient actually get on therapy? How much did my patient wind up paying? Where are they in the process? And making it so that their practice is able to answer questions. If that patient does wind up calling with a question, makes it so that, they feel much more empowered and that, your brand is easier to prescribe. Additionally, things like creating dedicated support teams, things like having multiple ways to engage with support, having, digital and, more traditional phone-driven service makes it so that HCPs are able to really communicate with the access journey in the way that they want. And then finally, Sham and Neil are going to dig into this in more detail, but being able to provide each of these stakeholders that we're talking about, those patients, those providers, and your brand teams, particularly your field teams, with real-time data and insights will enable them all to optimize this access journey. So digital hubs like PhilRx offer an all-in-one solution to help brands do the above, but they can also be put together through a variety of vendors and integrations. Typically, having a digital hub can be more cost-effective and offer more visibility for your patients, HCPs, partners, and teams. But really, on this call, we'll walk through how to make sure that you have, all of the data that you need to be able to make an informed decision on whether a digital hub is kind of the right choice for you or not. Okay, so we're going to go into some more kind of details and some examples of how this plays out from a brand perspective. So, starting with Sham, I'd love to hear what are some of the biggest wins that you've seen for brands that transition to this type of modern access journey?
Yeah, so the data nerd in me, loves numbers. And one case that came to mind, just to give you a short example, is there was this women's health brand we were working with, and we were working on a pilot before we launched nationwide. And in that pilot, what we saw was, in women's health, this product needed 3 months before there was some real efficacy determination made. And a lot of patients were sort of dropping off on that second script, things that we weren't really able to see until they joined with Phil, and we had that level of insight into the the actual script journey and the patient history on every single script. So what we did was we took a look and saw that for these covered scripts, especially where they were already being bought down to a super low copay of $20, there was a drop off happening right before that third fill. And for this drug to be successful, we needed patients to stay on till the third fill so that they can actually decide if this product makes sense for them. One of the things Phil suggested was that since we already had a super low copay buy down for these covered scripts, why don't we drop the copay altogether for the third fill and start it again on the fourth fill? It was something that we tested out in a small sample, saw that, on those really small number of scripts, these patients were actually going through and filling onto their fourth, fifth, sixth fills as well. And what ended up happening was when we rolled out the program nationwide, we decided to take that approach to the coupon, where the first 2 refills were bought down completely, and then the third fill had a copay attached. What ended up happening was that the total number of fills went up by 20%. And so patients were actually able to get the therapy to the point where they were able to make a determination if it worked for them or not. HCPs were able to say that, okay, my patients are going to get on this therapy and they're going to actually be able to use it. And then I can make a decision as to whether or not I need to pivot. And finally, for the client perspective, they ended up having 20% more adherence, more fills with a very minimal cost. And they weren't losing out on these covered scripts that they were already getting some reimbursement for. So it was just a win across the board where we were able to have, patients winning, HCPs winning, and the client winning, providing them with a product that worked and an experience that was a lot better. I know we're talking about other cases as well, so I won't get too in depth with it, but I'll plug the next webinar a few times, which is going to be a lot more data heavy.
Thanks, Sham. I think that's a great example of how using a access partner that has kind of that end-to-end data on each individual script, as well as the program as a whole, everything from the script coming from that EMR all the way through the coverage determinations and refill adherence, allows you to make really strategic decisions about your access journey in order to help get more patients onto and adherent to therapy, as well as, optimizing your gross to net as a brand and the experience for HCPs. I think that's a great example. Neil, I'm going to ask you the same question.
Yeah, I think the one that comes to mind is also, it's another one of those aligned incentives that Sham talked about. Great for patients, great for the manufacturer, and great for HCPs. The one that I think exemplifies that really well as an ophthalmology brand, a new arrival in a pretty saturated market. Is novel therapy, but kind of a tough mountain to scale given that it was a launch drug. So what we did in partnering with them is kind of attack almost every angle here to differentiate the experience of HCPs and the patients from the rest of those folks in the field. And so everything from providing that digital enrollment in auto refills to a population that wasn't being serviced that way before. So kind of bringing them into the modern century. And then for HCPs, doing a ton of education via the field team, but then also out of Phil itself. So calling HCPs, doing welcome calls, educating them on our PA process, having the field team educate them on the PA process, how we reduce a ton of work by pre-filling as much as we can, by trending per payer, what needs to be included, and then giving them updates around, as Catherine has mentioned, how is their patient doing? What is the price that their patient's getting? Is it a good experience or not? Is anything hung up? How are we following up with their patient? So all of that kind of black box stuff that I mentioned earlier on is something that we're able to address for this program. And lastly, our dedicated support teams, especially in ophthalmology, there's a cohort that's probably less inclined towards digital. We're able to kind of bring them in, not exclude them through actual follow-up, manual follow-up. And then, as we've been saying, the channel data and insights are super important. So in Sham's example, we iterated with a program through several different configurations until we found out here's the maximum path of buy down that will get folks on therapy, and when you really start to see adherence hit. Same thing in this instance, where through that data we're able to trend how things are going, make adjustments really quickly, which is one of the advantages of being kind of software enabled. Talk to their field teams, talk to their marketing teams around what's going well at an HCP level. Where do we need HCP or regional level so that we can target messaging with field teams and really get that process working and improving continually. And so the punchline here is that this was a massive success. We're able to drive significant HCP adoption, especially kind of as an industry standard, well above those of the incumbents. And their gross to net dollar goals were reached way ahead of schedule as well. And again, speed and iteration is something that is so valuable in such a complicated domain, that because we had that data, because we could partner with the client on that data and come to kind of a collective decision-making process that was data-based, evidence-based, we're able to stay aligned, experiment, and ultimately arrive at a really great solution that's not permanent. We can still change it. So we found this client needed to kind of, on a yearly basis, make some updates as well to keep driving those gross to net numbers. So that's kind of the flexibility that we can offer, and the alignment that we can offer through data. This client ultimately ended up, again, it was a launch drug. They drove a 20x valuation multiple that helped in a subsequent acquisition. So a huge demonstration of kind of all of these pillars of going at a problem of HCP engagement, adoption, patient experience, and then field enablement towards HCP influence and education.
Thanks, Neil. In the previous slide, we talked kind of about the overarching kind of wins and stories that this modern access journey can provide. Now we want to dig into some more concrete strategies that you can use to streamline your access journey. And the first is really creating a digital access program for patients. And this is as simple as setting up a mobile enrollment process for patients that includes text updates. It includes opting into informed auto refill process, as well as a telemed channel, if that makes sense for your patient population and therapy. And what that does is it drives patient access, engagement, and adherence. It also enables you to start that data collection at the outset, and really be able to track that patient through their access journey, so that you can continue to optimize that experience for patients and providers, while also being able to maximize your brand outcomes. Mira, I see you popped back in.
Yes, we have a question here. So someone asked, for a launch brand, how long do you recommend having a new strategy or program in place before making changes such as copay?
I can go ahead or Sham, yeah, go ahead, please.
No, I was going to say that's a good question. I think it depends on at what stage of launch, right? So like if you're launching a new product in the wild, I know that you don't have the opportunity to iterate as quickly. When we launch a product at Phil, we tend to have a pilot phase first where we're testing out, coupons and things like that. So we can confirm exactly what price points are working and then iterate before we do a nationwide launch. I think in a vacuum though, again, data nerd, right? You need enough of a sample to understand what's happening. And so I can say it'd be like 2-3 months, but really it's dependent on, how many scripts are getting through the door, how many people are dropping off, understanding what the price they're seeing is, understanding if they're being enrolled in patient support programs. All these things play a factor into deciding whether or not the price is the real issue or there's other things that are stopping them. I would say, in the wild also, your PA process is so difficult that that might be the actual concern and not the copay, right? Like if 80% of your scripts that require a PA are not getting one, then lowering the price just does you a disservice, and honestly the patient too, because the price that they'll be paying out of pocket will most likely be higher than what they would have gotten at a covered rate anyway. So I don't have an exact time frame. I don't know, Neil, Catherine, feel free to chime in, but I think there's just a lot at play here.
I might add one thing too, which is that the other thing to keep in mind as you're moving through that question and trying to figure out whether you have the volume and the insights you need to make that decision, just to acknowledge that there's also a fair amount of enablement that you have to do with your field team, and then you have to educate HCPs around that and make sure that if that's too tight a turnaround, you could create a little bit of HCP churn as far as fatigue and messaging or confusion. So that's another one of those things where data helps really tightly align, tell you the right thing, such that when, as Sham said, you have the data, you're able to diagnose it properly and really target the change versus kind of doing an overhaul or a revamp just to try something different.
Yep. I don't have anything additional to add. I think that those are great points, and is something that you can work with your access vendor on putting together the right strategy and kind of the right success criteria so that you know exactly when it is that you're ready to make that decision. Sham, I have a question for you. So what are some of the challenges that manufacturers tend to face when transitioning from a traditional patient engagement tool to a digital, patient engagement process? And what have you seen work well to overcome those?
Yeah, and I think this audience sort of hit the nail on the head earlier when they talked about, HCP, just getting them engaged, getting access to them. Because when you're switching tools, HCPs are going to be probably the biggest laggards in terms of adopters. And so, they're creatures of comfort. They've been doing things a specific way for years. And so they're, really just, it's tough to convince, an HCP to do anything differently. I'm sure everyone in this audience knows this. I'm sure that's probably, the cause of many a frustration and many hairs pulled out. But I think the one thing that always moves the needle for HCPs in my experience with them is patients, right? So if you're able to get wins for patients, if you're able to say that there's an impact on patients getting on therapy, on reducing their costs, on them adhering to the therapy because it's easier for them to get the therapy, it's easier for them to afford the therapy, and it'll show up at their door. I think HCPs are more than willing to make a change when they know that, their patients are going to listen to them or they're going to be enabled to listen to them. So that, hammering in that better patient experience obviously is like the key selling point to getting to physicians. But I think there's also an aspect of ensuring that, the field is there to support like the new tools and the new digital programs, because at the end of the day, it's not going to happen in a vacuum. If HCPs learn about it from a text or email, they're not going to be like, oh, I'm going to start sending patients this way, right? You need to make sure that the sales team is aware of, not only the issues that the HCPs are facing, but how they're going to be solved by these new digital tools, and what the outcomes are going to be for patients. So it takes both like on the boots on the ground approach, but also making sure that like once the HCP tries a product, it works. So if you manage to convince an HCP to send that first script over and they just have a horrible experience, it's just something that's not going to stick anymore, right? It's sort of like, hey, I tried this, I'm not going to do this anymore. So I think, obviously at Phil, we have that visibility to be able to double click down to each HCP, see when they first sent a script over, see how like their volume has gone over time. And so we can sort of be like, okay, well, we can reinforce this at a territory level or at a rep level and say, hey, like this HCP needs someone to go back and, talk to them more, or there's something wrong. But in general, I think, you got to get that first impression right. And you got to make sure that there's someone actually walking them through it a little bit, because even if it is self-explanatory, it's so new that you just need that little bit of extra help.
Great. Thank you. The second strategy that you can implement is simplifying that PA process for providers. And so that is, creating a software-driven PA process to drive submission and really increase your chance of covered dispenses. And also having, a good feedback loop into PA success and what is working and what is not. But, Neil, I would love to hear from you if there are any, tactics that you would dig into here.
Yeah, definitely. So I think when a PA is required, what is the lowest friction way for a HCP to get it done? And then there's kind of even before that, how do we avoid a PA if possible? And so as we think about process and software, particularly at Phil, we are looking to do first time right submission of the script, and then really low effort submission of the PA if it's required. And so as soon as a script is submitted, we're testing for quality from HCP. Is there missing info? Is there anything look out of line? Is there anything that we know to be required that isn't there, because we know kind of what payers are expecting? So tried and failed reason ICD-10s. If we can get a really clean script through by the time that the payer gets involved, we can potentially even avoid the PA. So that's one huge win for providers, by just reducing the number of PAs. When a PA is required, we're able to, well, let's just maybe set as a baseline, PAs are a real pain. They're administrative overhead, they're repetitive, they take office resources. They're things that are affecting the availability of staff. And when it doesn't go well, they're extremely sensitive. And so when PAs are required, the important thing for software to do and for us to do in that is to make it a really simple process through pre-filling as much as we can, through coaching them through the process, through making sure that when we let them know they're PAs, we're doing it in a way where we're optimizing for their workflow. So in product, we put them ourselves kind of at the front desk or the back office, wherever PAs are being done. We talk to the folks that are doing them, literally just pounding them out day after day, and make sure that what we're sending them, the information we're sending them, makes total sense and makes it as easy as possible. One of the things that we're kind of the third step beyond making sure that a PA, if possible, is needed. When a PA is required, making sure that it's as low effort as possible. Second part is make sure that it's as likely to be successful as possible, such that there's actually a reward for doing that PA. And so the last part is making sure that if we have, because we kind of have this aggregate data set, we know which payer or plan is going to require which clinical information. We wouldn't provide that for the provider, but if they send it that information with the script, we're able to pre-fill it in. So that it goes into educating the provider, which we're able to do through repetition, through the communications that we have on what clinical criteria might be needed for a given plan. And so it's more likely to be right in that given scenario. So we have a lot of different hooks on there that goes through kind of the process of script, doing a PA, and making sure you don't have to do it again.
Great, thanks, Neil. The next strategy that brands can implement in order to really streamline this access journey is to optimize your pharmacy services. And, this can mean offering a digital pharmacy service with home delivery and having a managed dispense network that makes sure that as many plans as possible are included within it in order to optimize the number of covered dispenses that you're able to offer for your patients. Neil, what are some of the benefits of a managed dispense network as it relates to the patient and provider access experience?
Yeah, not dissimilar to other areas of business or technology where it helps to have kind of diversification. The same principles kind of apply to managed dispense network. So let's pretend it's not managed dispense network. You just have this monolith that is unable to modify itself quickly in terms of coverage. It is centrally geographically located. A couple of problems with that. And so when we think about a managed dispense network, what you have is the ability to change it at will. Think of it as kind of like nodes in the map of the United States that you can bring up and take down as needed. Each of those nodes might have some sort of a specialty that you can benefit, whether that's being closer to your patient or whether that's being having coverage so that you can route there. That's the kind of geographical benefit, the diversification benefit of coverage, and then also just the fact that it's really responsive. So if we have kind of a novel case that it isn't covered, it won't remain that way for long. We're able to get really fast coverage. So on the whole, I think we're looking at roughly plus or minus 95% contract rates for our scripts, which is, again, because we have teams dedicated to making sure that they are partnering with the right partner pharmacies and geographically in terms of a coverage standpoint as well.
Great. And the last strategy that I think is really important for us to talk about is the ability to optimize field team training through that data that we've been talking about and through really strong territory analysis. And so being able to take your full kind of program data and break it down on not only a territory basis, but an HCP by HCP basis in order to understand how things are performing, who is getting on therapy, and where those blockers are, allows brands and field teams to make targeted optimizations to get more patients on therapy and to continue to improve that HCP experience. Neil, Sham, I'm going to turn this over to you, but would love to hear some of those, most effective territory optimization tactics that you guys are working on.
Yeah, I think you said data, so I'm here. I'm here for it. No, I think one of my favorite things here is just, like I mentioned, data, but the ability to see things not just at a region level or a territory level, but down to the HCP level, the metrics that, matter, like PA submission rates, like how many patients are coming out covered outright, how many of them are covered post PA. Work on the HCPs that need more handling and really identify those leaders that are, pushing the envelope and making sure that their patients are getting coverage, are submitting their PAs properly. And so we can take not only, territories that need help and identify those, but also find these best practice territories to say, hey, what's working well here? Let's find out at the next sales meeting. Let's make sure that we highlight this to everyone so that we're able to get similar results across all territories. I think, I'd like to think that the sales reps really like working with us because we provide them with like the kind of data that they've never had access to before. But we can confirm that in our next meeting with them. I think that, the other thing that Neil mentioned earlier, and maybe you can elaborate on this, but like being a part of the reps workflow. So like ensuring that, we're not only providing them a new tool that, that'll change the way they work, but we're doing it in a way so that it plugs right in with what they're already doing and making sure that it's improving their current processes as opposed to being another thing they have to worry about, right? I don't think of it as like checking a box, but I think of it as like a little handbook to say, here's where I need to put more effort in, here's where we're already doing well. And then finally, just like the field reimbursement teams are more able to, impact change because they're able to see the actual results of the work that they're doing. Neil, I saw you were about to say something, so let me pause for a second.
Yeah, I think that's exactly right. And the way that I, had thought about it from when I was building sales enablement software, as well, as that you can have the right content, you can have the right information, but the way that you message it is really important. And some of that is just coordinating with the sales management and sales leadership to make sure that here are these insights. Here's what you should do with them. What's unique to your sales culture that's going to make this have to be a certain type of messaging? Or here are the sales managers that, because they have really figured it out, they have a great technique. How do we want to deploy them and sort of making sure that those good or best practices spread within the organization? And then also, as Sean mentioned around workflow, like, I think the average rep has about 26 pieces of software in their tech stack. So adding another one can oftentimes be a distraction, but if you provide value around their actual workflows now, so you're in their workflows, similar with what I mentioned around an HCP. So I'm doing route planning. Okay, what do I see in Phil to help me understand which office to go to? How is this data going to help facilitate me as a sales manager, my coaching conversation with my sales team or a general team kind of review? What is the best way to have a conversation with an HCP office based on what do I see in terms of trends? These are all things that are available as data and insights and kind of applicable strategy in the way that we deploy them at Phil.
Great. Thank you, guys. So finally, I just want to wrap this up with a case study of a client that we launched with not too terribly long ago and have seen really kind of impressive results, pretty quickly. So this is a derm brand that was facing pretty fierce competition in a highly saturated market. And they were facing a number of different challenges. So one was a lack of patient awareness about kind of how to use the product, why to use the product, and when to use it, as well as, you know, a number of other access burdens that were contributing to high rates of abandonment and non-adherence. They were also seeing, you know, low PA submission rates, high PA denials, even though they had pretty good formulary coverage, which was reducing affordability. One of the challenges that they also came to us with was that most of their HCPs were used to using their local specialty pharmacies. These specialty pharmacies promised the HCPs that they would, you know, never hear from them and that it would be a easy experience for that practice, which led to those low PA submission rates that we were talking about. And when PAs were being submitted, they were low quality and didn't have all of the information that they needed, which led to high denials. So their goals were really to, one, improve that patient awareness of the affordability programs that are available, improve patient awareness of how to take the drug properly in order to improve adherence. Additionally, they were really looking to boost that HCP engagement and PA submission rate, and then, you know, figure out how to optimize their channel performance in order to improve that HCP experience, improve their patient experience, and ultimately improve the number of covered dispenses and the financial performance of the drug. So we started with a regional pilot program that achieved really strong results. So PA submission rates went up 70% from pre-pilot within that region. They also had a 70% increase in their dispense rate. So for every prescription that was actually sent to the pharmacy, 70% more of them were actually being dispensed. And of those that were dispensed, 2 times more were actually covered by insurance than pre-pilot. So the brand did decide to roll out Phil as their channel partner in a nationwide program. So we were able to introduce a seamless enrollment process with really clear and timely updates for those patients, as well as informed auto refill process that ensured that the patients were getting their medications in a timely manner. We were able to put adherence messaging into the communication journey for that patient in order to boost adherence, to make sure that they were using the drug as prescribed, and getting their refills on time. The software-driven PA process was able to keep HCPs in their current workflows to make sure that they were actually putting the required information into the prior authorizations, by being able to pre-populate them with the information that came over with the script. And making sure that those prescriptions were being dispensed through Phil's 50-state pharmacy network, which led to much higher plan coverage and home delivery and a better experience for those patients and HCPs. So ultimately, the results were the brand is seeing 3 times higher patient adherence and 2 times more covered dispenses versus pre-fill. And they're able to drive an industry-leading enrollment rate and PA submission rate, which is really maximizing the chance of coverage and the likelihood that that patient starts on therapy. All right.
Amazing. So we are coming up to the end of the webinar and Q&A portion in case anyone has questions. We first just wanted to do a quick poll to see if anyone's interested in joining the webinar that we're going to be hosting that's all about data. So there's a poll on your screen, no pressure at all, but it's a really great opportunity. If you are interested in diving deeper into the data side, the channel optimization side, that's really what we're going to be covering in October. So let us know and we can definitely share those with you. Just going to leave this up for another minute or so. And then the playbook on the right is a really nice overview of what that digital hub could look like. It's great if you're just kind of getting your feet wet with what a design strategy could be and whether it might be right for your brand. So highly recommend checking that out if that is of interest to your team. All right, ending the poll. And want to make sure everyone has a chance to ask questions. So we'll stay open for another few minutes. All right, if we don't have any questions, we can give everyone a couple minutes back. Sham, Catherine, Neil, thank you so much for being here today and sharing your insights with us. This is a great conversation. Everyone who attended and took time to be with us on your Tuesday, thank you so much. We really enjoyed having you on the session, and we hope you thought it was helpful and valuable. If you do have any questions that come up, please feel free to reach out to any one of us. We'd be happy to help. Otherwise, we hope to see you on the next session.